health, a consultant neurologist, Dr. Temitope Farombi, warns that by 2030, Nigerians may face triple the current burden of brain disorders. Speaking in Ibadan, the Oyo State capital, Dr. Farombi highlights rising cases of epilepsy, stroke, depression, and other neurological conditions fueled by hypertension and diabetes. Dr. Farombi, who trained abroad, urges government policies to retain top talent in Nigeria. She stressed the need for a transformative step for Nigeria's healthcare system, addressing gaps in brain health care and supporting long-term recovery for patients. Joining us from Ibadan in Oyo State is Dr. Temitope Farombi. Thank you so much for joining us, Dr. Farombi.
Thank you for having me.
Now, given the alarming projection of a threefold increase in neurological disorders by 2030, what are the potential health and socioeconomic impacts on Nigeria?
Thank you very much. Nigeria is largely a young population, where we have more than 45% of our population less than 15 years. So what that means is that as people continue to have neurological condition in their early active years, that will have a serious impact on our economic activities. Because when a young person develops stroke as a result of uncontrolled risk factors, and they are essentially taken out of workforce and they are unable to continue to work. And that have a grievous impact even on our economy. Right now, we are looking at over $300 million being lost every year for as a result of neurological condition. So the impact is grave, and if the government is not proactive enough to do the right thing by educating the populace and ensuring there are enough infrastructure or support system in the healthcare system to ensure that neurological condition is prevented, this will have a high economic impact on the government, and also the productivity of the nation also is at stake.
All right, Dr. Farombi, can you tell us what exactly are the causes of some of these, neurological disorders? Because there seems to be a whole encyclopedia of different types of neurological disorders from A to Z.
Yes, thank you very much. Right now, the driver of this burden or this increase, number one, is stroke in Nigeria. And now we are having almost epidemic of stroke cases, even among young adults as low as 18, 25 years. And what is driving these are the major risk factors. One, the non-modifiable and the modifiable risk factors. The modifiable ones are the hypertension, diabetes, stress, even poverty, lack of sleep, and lifestyle that are very like excess use of alcohol injection, as well as smoking. So that's stroke, diabetes. One of the hypertension, diabetes are the things driving stroke in our society. And we have 1 in 4 persons in Nigeria having hypertension and 1 in 6 persons having diabetes. Also, beyond that, we are also experiencing neonatal brain injury, that is at birth. That's another thing that is driving neurological disorders in Nigeria. A lot of birth injury occurring as a result of poor attendance to pregnant women, even during birth. They having brain injury while at birth also is a major concern. I listened to a part of your news that you talk about 5 million children having malnutrition. So the impact of malnutrition on the brain or growing brain of a child also is very, very critical. So, and that could have a deleterious effect. Also, we are having increase in epilepsy, and as a result of environmental problem, exposure to toxins, to pollutions. These are the things that are driving the neurological burden in Nigeria at the moment.
All right. Now, but would you say that the Nigerian healthcare system is adequately equipped to, handle this anticipated increase in, these neurological disorders?
Unfortunately, in Nigeria, we have less than 100 neurologists catering for over 230 million people. So that's a very huge gap even. So there's a huge skill gap here, and the resources to provide neurological care is abysmally low. So we are not ready. However, I could see that the Ministry of Health is trying to set up health fellows, health research fellows to join, or health ambassadors to join the health workforce. Hopefully, they will be able to at least manage the gap to create awareness and educate the populace. But when it comes to critical care, intervention, and also management and rehabilitation, the workforce is largely, it's not there to cater for this huge burden that is upon us. So I would say Nigeria is not there yet. Even in some cities or some villages, there are no neurologists, and people don't, and also the stigma around neurological condition also is still there. Person with epilepsy is seen as a result of evil, or that epilepsy is transmissible via the saliva, which is absolutely false. But then the belief system of Nigerians is actually preventing them from accessing even the limited healthcare services that we have. Somebody with stroke is believed to be struck by a thunderbolt or by something else that is aside health condition. So health-seeking behavior also is very poor. So these are the things. So one, Nigerians need to be educated. Government needs to do more to put out the information out there. There's fire on the mountain, and we need to also find a way to retain our headaches, neurologists, psychiatrists, those who are working in the mental health field and also the neurological field needs to be retained, because right now they are actually emigrating in their droves. And
but what do you think? What do you think? That the government can actually do. What can the government do to retain these very, very intelligent doctors, and stop them from moving? Because I think the government has actually tried their best, but it doesn't seem like Nigeria is favorable enough for them to want to stay.
Yes, the current economic crisis is a major driver for immigration, and also infrastructural deficits. There are hospitals without even light, electricity. So how do you work, even having had all the knowledge and you cannot even implement it? So they need to do an emergency infrastructural drive even in our healthcare system, and also the welfare of medical professionals, health professionals generally, should be prioritized. Right now, the inflation has eroded into what is even left of medical professionals to be able to afford the basic for their families. And not having the appropriate welfare packages as well as poor infrastructures within their work environment, also, these are drivers for immigration. Okay. So what the government can do is to ensure that there's an emergency response to revamping our healthcare system, ensuring that we have infrastructures in place to support the workforce, and also then to be able to improve the welfare of healthcare professionals in Nigeria.
All right. Well, thank you so much, Dr. Farombi, for enlightening us on that.
Thank you. Thank you for having me.
It's a pleasure.